Vitamin D, also known as ergocalciferol D2, cholecalciferol D3, and alfacalcidol, is a fat-soluble vitamin that helps your body absorb calcium and phosphorus. It is essential for building and maintaining strong bones, and is used to treat and prevent bone disorders such as rickets and osteomalacia. Vitamin D is produced by the body when the skin is exposed to sunlight, but certain factors such as sunscreen use, limited sun exposure, and dark skin may prevent adequate vitamin D absorption. Vitamin D with calcium is used to treat or prevent bone loss, also known as osteoporosis, and is used in combination with other medications to treat low levels of calcium or phosphate caused by certain disorders. It may also be used in kidney disease to maintain normal calcium levels and promote proper bone growth. Additionally, vitamin D drops or supplements are given to breastfed infants due to low levels of vitamin D in breast milk. The recommended daily dosage of D-Visol may vary depending on age and specific health conditions, so it is important to consult with a healthcare professional for personalized guidance. It is often recommended to take D-Visol with a meal to enhance absorption. When taking D-Visol, it is best to take it after a meal for better absorption, but you can also take it with or without food. If your doctor has prescribed this medication, follow their directions based on your medical condition, sun exposure, diet, age, and response to treatment. If you are using the liquid form, use a special measuring device to carefully measure the dose. If you are taking the chewable tablet, chew it thoroughly before swallowing. And if you are taking the rapidly dissolving tablets, place each dose on your tongue, allow it to dissolve completely, and then swallow it with saliva or water. Certain medications can decrease the absorption of vitamin D, so it's best to take D-Visol at least 2 hours apart from these medications. If you are also taking these medications, it may be easiest to take D-Visol at bedtime. Take this medication regularly at the same time each day or once a week on the same day to get the most benefit from it. If your doctor has recommended a special diet, it is important to follow it to get the most benefit from D-Visol and to prevent serious side effects. And remember, do not take other supplements or vitamins unless ordered by your doctor. If you think you may have a serious medical problem, get medical help right away. It's important to note that at normal doses, vitamin D usually does not have any side effects. However, if you experience any unusual effects, it's best to contact your doctor or pharmacist right away. If your doctor has recommended D-Visol, it's because they believe the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. It's important to be cautious of taking too much vitamin D, as it can lead to harmful high calcium levels. If you experience any signs of high vitamin D/calcium levels such as nausea/vomiting, constipation, loss of appetite, increased thirst, increased urination, mental/mood changes, or unusual tiredness, it's important to contact your doctor immediately. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, and if you notice any other effects not listed, it's best to contact your doctor or pharmacist. As always, if you have any concerns or questions about the side effects of D-Visol, it's best to consult with your healthcare provider for personalized advice. It's important to talk to your doctor or pharmacist before taking D-Visol if you have any allergies to vitamin D products. This medication may contain inactive ingredients that could cause allergic reactions, so make sure to discuss any concerns with your pharmacist. Before using D-Visol, it's also important to let your doctor or pharmacist know about your medical history, including any issues with high calcium/vitamin D levels, difficulty absorbing nutrition from food, kidney disease, or liver disease. If you're considering D-Visol and have diabetes, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid sugar, aspartame, or alcohol, be sure to talk to your doctor or pharmacist as well. It's also important to inform your doctor or dentist about all the products you're using before having surgery. During pregnancy, it's recommended to only use doses of vitamin D greater than the recommended dietary allowance when clearly needed, and it's crucial to discuss the risks and benefits with your doctor. Lastly, if you're breastfeeding, it's important to consult your doctor before using D-Visol. When taking D-Visol, it's important to be aware of any potential drug interactions that may affect how your medications work or increase the risk of serious side effects. Some products that may interact with D-Visol include burosumab and phosphate binders. It's important to check the labels on all your prescription and non-prescription/herbal products, such as antacids, laxatives, and vitamins, as they may contain calcium, magnesium, phosphate, or vitamin D. It's best to ask your pharmacist about using these products safely. Additionally, vitamin D is very similar to calcitriol, so it's important not to use medications containing calcitriol while taking vitamin D. Furthermore, D-Visol may interfere with certain lab tests, such as cholesterol tests, which could potentially lead to false test results. It's important to make sure that lab personnel and all your doctors are aware that you are taking this vitamin. As for the daily dosage and optimal timing of D-Visol, it's best to follow the instructions of your doctor or pharmacist. They will be able to provide personalized recommendations based on your specific needs. If you suspect someone has overdosed on D-Visol and they are experiencing serious symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include seizures, confusion, and irregular heartbeat. While taking D-Visol, it's important to have regular medical tests to monitor calcium, magnesium, and phosphorus levels. Make sure to keep all medical and lab appointments and consult your doctor for more details. You can also get vitamin D from foods such as fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. It's important to ensure you're getting enough vitamin D in your diet to support your overall health. As for the daily dosage of D-Visol, it's best to follow the instructions provided by your doctor or pharmacist. They will be able to advise you on the optimal timing for taking this medication, as well as the specific benefits it can provide for your health. If you forget to take a dose of D-Visol, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. When it comes to D-Visol, it's important to store it at room temperature, away from light and moisture. However, if you're using alfacalcidol drops, those should be kept in the refrigerator, but make sure not to freeze them. And as with all medications, it's crucial to keep them out of reach of children and pets. When it comes to disposing of D-Visol, make sure not to flush it down the toilet or pour it into a drain, unless instructed to do so. Instead, properly discard the product when it's expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company. Now, let's talk about how D-Visol can be beneficial for you. This vitamin D supplement is often recommended for infants and young children to help support healthy bone development. The daily dosage will depend on your child's specific needs, so it's important to consult with your healthcare provider. And as for the best time to take D-Visol, it's often recommended to give it to your child with their regular feeding. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.